Hi there, I'm Trichologist Carolyn at Absolique Hair Health Clinic. Today our topic is a male pattern hair thinning. We've got some treatment results to share with you, and we're doing it without minoxidil, so there's no minoxidil here as well. So we'll just talk a bit about pattern hair thinning, what it is. It's happening in men and it's not supposed to happen until over 40 years of age, and it's a gradual miniaturisation, so it is not hair loss, okay? So you need to distinguish the difference between that, and it only ever happens in what we call the recessions, front, top, or crown of the head. It doesn't affect the whole head. So that's the male pattern hair thinning. It's traditionally been treated with minoxidil type formulas for the last 25 years, but now we have many alternatives because people don't want to or cannot use minoxidil. We're also talking here about finasteride, Propecia, Proscar, the things that cause long-term side effects. Okay, so male pattern baldness, it's hereditary, but these days we're seeing what we call early onset, so they're having other environmental contributing factors. So even if you don't have any history, you can actually get this happening to you as well. So it's normally a very slow progressing miniaturization, so it's another way of knowing whether it is true pattern thinning. If it's happening really fast, there's another factor happening. So when we're trying to get hair regrowth for the men, it's really important to get an underlying cause, a look at what else is happening here. So in this case that we're going to show you our before and afters today, he had a hair cycle breakdown. So his hair cycle was not functioning anymore, and his hairs weren't actually growing properly to their genetic hair type because he had low ferritin, low vitamin D, low B12, and he was actually an otherwise healthy person, but we found that all these things had happened throughout university. Okay, so the hair loss treatment for men that I help with must address the underlying causes to help to get to the result. So people ask me for a hair growth products, so I need to look at what's actually happening. So as we said earlier, minoxidil's been around for a long time, but there's a lot of new technology with stem cell, growth factor, and all these different things. We have so many other choices. So sometimes I might use my basic treatments to stabilize the hair cycle. In this case, again, we worked on the hair cell, the hair cycle first while working on the pattern hair thinning, and then we went in with our targeted hair growth treatment. Time frame is 4 months, and then if you're otherwise healthy, you could hold on to those results without having to continue to use the things like minoxidil. So the best hair regrowth for men is to get help. Okay, is to get a correct diagnosis. Don't go and waste time and money on products that you don't even know what they are. You stop using them, you get more hair loss, you're back to where you started. If you come and get a proper diagnosis to start with, then we can get you some hair regrowth. You know what to do. Email me, info@absolique.com.au.